I'm waiting for you to webinar, and then he should show up under attendees. Hopefully. All right, we're live.
Fantastic. Thank you, Larry. Evening, everybody. We are at the September 21st, 2022 Community Services Committee meeting of the Common Council. I'm Dominic Johnson, the chair. I will do our roll call. It is now 7:01 p.m., 7:02 p.m., I should say. And so present with us is Councilmember Greg Burnett and Councilmember Heidi Alterman and Councilmember Nicole Ayers and myself. Being 4, that is a quorum. We just made that. So we can conduct our business this evening, and we have some very good presentations as well before an action item. So first off, I'd like to open the floor for public comments for anyone who may be attending the meeting on Zoom. Larry, do we have anybody?
No, we don't.
Great, thank you. Checking the Zoom, we don't have anybody here. Did anybody on the committee receive any correspondence from residents about our agenda items? I did not. Lamont, I see you also shaking your head.
I have not received anything, Chair.
All right. That means we can close public comment. So we'll close public comment for this evening. Next order of business is to approve the minutes from our meeting held on June 15th, 2022. We did not have action items over the last 2 months, and with the summer vacations, this is our first meeting since then. May I have a motion to approve the minutes?
Motion to approve the minutes, Greg Burnett.
Thank you, Councilmember Greg Burnett. We've got our motion. Any edits, corrections, or deletions, changes? I did not see any myself. So last call. No. All right. So Greg gave us the motion. All in favor? Raise your hand or say aye. Or
Aye.
Nicole, I could see. Oh, great. Thank you, Nicole. I see your hand. That is unanimous. 4 of us approve. Thank you very much again, Greg, for moving that. Thank you all.
Chairperson Johnson.
Yes.
It appears that 2 people from the public have at least one hand has raised.
Oh, thank you. I did not see.
They might have come in after we closed public participation.
They did. I do see that now. I don't know the protocol since we've already closed it. If we can reopen, I have never done that as a chair. Has never been in that position.
I think it's within your purview to
My purview.
accept the raised hands. It
Okay.
appears only to be 1.
That is right. I see that one. Well, based on your advice, Councilmember Burnett, I will take that. Since someone made the effort to come here, I will reopen our public comment. Thank you for that advice, Greg. We can, I guess, unmute, or I see it's Diane Lauricella.
Yes, it is correct.
Yeah. Thank you, Chairman Johnson. I was having trouble getting on the Zoom, and I don't type quickly and my name quickly enough in to I have to take some classes with Mavis Staples or whatever her name is. Anyway, I just wanted to pop in. I am actually looking at the zoning changes, industrial zone, but I wanted just to say that I will review the recording of what is discussed here. I looked at the agenda, but I do want to just posit something that some of you have heard before, especially our health director. It is my understanding that the Omicron variant is more contagious than previous variants. Gladly, it appears to be less leading to death and hospitalization, but there are still deaths in our country and in our state and in our city. There are hospitalizations in our city, but there are deaths in America. The reason I am mentioning this is because I have, ever since the pandemic began, urged the city staff and whatever committee of the council was sitting, which is many of you, to use creative methods to reinforce the tools people can use to maintain safety as much as reasonably possible. And especially the fact that these tools, as we approach Thanksgiving and Christmas, people are busy. We're recovering from the pandemic. Lots of changes were made. We, as a city, should not assume the public just automatically knows what to do. Unfortunately, our governor one time said in a press conference, "Oh, the public knows what to do." That is incorrect, because they are laymen. And so we need the wise advice of the health department, epidemiologist, the entire city. I'd love to see city council members doing some dog and pony shows in their district to just give a little more discussion about what kind of mask should be used. Is it okay? Should we maybe reimpose if and only if we have increased numbers? But let's just get people knowing that they still should employ some of the tools in the toolbox. And I will continue pursuing this only because it's not fair to the public not to have the help of professionals and others. And even if those professionals, they don't have to be within the staff has access to other communicators of science, and they have still not used it enough, in my opinion. So thank you for letting me speak. I will again continue with ideas that I have leveled and taken my personal time over the last 2.5 years. I just don't believe we can only depend on people to look at the city website. We need to get out there, be more creative, have stand-up posters at our new vaccine places, etc. Thanks so much.
Thank you very much, Ms. Lorchell. Appreciate your comments tonight. Appreciate you making the effort to come to give our public comment. Thank you. Have a great night.
Thank you.
All right, we will close public comment again unless we see anybody who is, while open, I do not see any attendees. So we will close public comment again, and that means we can move on to discussion. And I'll pass the floor over to our Chief of Community Services, Lamont Daniels. Thanks, Chief.
Hi, good evening, everyone. Good evening, Norwalk. Good evening, council members. So it's been a while, so welcome back, and we look forward to sharing and discussing what's happening from the community service perspective, but also to continue to provide opportunity, provide updates of what we're doing throughout the entire department. So based on my conversation with the chair, we're really excited again to welcome our health director, Deanna Diamore. We do have some presentations, but more importantly, we do want to give some updates around COVID, monkeypox, the flu. And we also have invited, and Brian is with us as always, but we also invited Teresa Argandesi, our Assistant Director of Community Health, to be with us to share some great things that are doing. And then also we're so excited to have Daniela with us and our guest presenter, and we'll let Deanna kind of bring them in as well. But this is an opportunity to share and provide both to yourselves of what we've been doing and also our residents of some updates as it relates to public health. So through you, Madam Chair, I'll yield the floor to our director, Deanna Moore, and she'll walk us through the discussion part of the agenda. Thank you.
Thank you so much, Lamont. So good evening, everyone. I'm Deanna Diamore, the health director for the city of Norwalk. And so as Lamont just mentioned, I'm gonna give some updates about, COVID and flu and preparedness, but I would just like to start off reflecting on Ms. Lorchella's comments about, outreach and communication with COVID. So I'll just start off by, we've talked about our outreach and under Lamont's leadership with the community services calls and reaching out and doing education to community providers and having them assist us with messaging, which has been so critical, in addition to the social media and website. I am happy to report that, we've talked about our community health workers. So from January to June of just this year, within 6 months, they attended 30 different community events and they engaged directly with 1,200 people, giving COVID prevention messaging and talking about vaccines and masks and the sort. So just wanted to share that with you all because I think it's really exciting and I'm really proud of the work of my staff under Teresa's leadership with the community health workers. Related to COVID-19 with vaccines, we are working with our community providers and partners to provide vaccination opportunities within the community. But I also want to say we're organizing our own clinics right now. So we will be having COVID-19 booster clinics on September 30th and October 7th from 3 to 6 at Norwalk City Hall. And we're going to be offering the Moderna bivalent vaccine for individuals 18 and older. The appointments will be required, and we're going to have the registration links posted on our website, norwalkt.org/vaccine, in the next day or two. And we'll also have phone lines to be available for people who need assistance with registration if they're not able to access, online, or if they need assistance with translation. So happy to report that. Also want to share that we will be hosting flu clinics. So October 20th from 10 a.m. to 12 p.m. we'll have a flu clinic at the Norwalk Senior Center. And November 3rd, we'll have a clinic at Brian McMahon. So thank you to NPS for their partnership as always. And we're going to have a clinic from 5 to 7 p.m. Again, appointment will be required. We're going to have registration links that are going to be posted on norwalkt.org/flu. We should expect that within the next week. And again, phone lines are going to be available for people that need assistance with making those appointments, with registering. Before I pass it on to Brian to give his updates on surveillance with COVID and monkeypox, also wanted to just reflect that September is Preparedness Month. And I know many common council members discussed this at a public safety and general government committee meeting. But I just wanted to share, from our perspective, from health perspective, we're currently training new members of our emergency response team. We're also hosting meetings with our existing members of the emergency response team, and our most recent meeting including a training from the Red Cross on shelter management. That went really well. We had over 40 of our volunteers participate in that. And our emergency preparedness staff and our emergency response team volunteers also participated in Region 1's Preparedness and Response Field Day that was held this week in Westport. We got some coverage from the hour about that. One of our volunteers was featured in that, so that was exciting to see. Lastly, I just wanted to also reflect that September is Suicide Prevention Month, and so many of you have heard about that grant that we have received from the state. So we're still waiting for the contract to be finalized to officially begin, but we've already begun the work by engaging with our partners. We're planning a kickoff meeting for next month. We're also sharing and amplifying suicide prevention messages on social media, and we're contributing to the Hub's large regional ad campaign, which includes signage on platforms at the East Norwalk and South Norwalk train stations, and also paid content in local media. So those are my updates. And then I would like, if it's okay, to pass it on to Brian Weeks, our Program Director of Epidemiology and Informatics, and then we can go to Teresa after Brian. So thanks.
Thank you, Deanna. Thank you, Chief Daniels. Thank you, everybody. So let me just jump right into it. I'll share screen. So this is going to be a little bit different from our usual presentation. As you'll see, what's loading out is the City of Norwalk COVID-19 Data Hub. So this was put together a couple months ago just to give all the information readily available, not only at the city's perspective, but also the community and community partners level. So they have this information and they can work with it and understand what's going on in real time. And so basically this is the loadout of the page. The web link is norwalkt.org/COVID data. And so a very simple link in that regard in terms of accessing. And so once you go to the website, this loads out. Right away, it goes into the CDC COVID-19 community level. So this is obviously the very important metric developed by the CDC that informs us that a 3-tiered system for low, medium, and high in terms of COVID activity, especially relative to severity. So severity of illness, which is, the case rate as well as the hospitalizations. Those are the major metrics that they're utilizing here. So I've taken the liberty to already kind of process this information for Fairfield County with the recent update, because this gets updated once a week, every Thursday. We are currently in the low. And so the low recommendations are to stay up to date with COVID-19 vaccines. So that includes the booster doses in excess of obviously getting fully vaccinated, getting tested if somebody has symptoms, obviously not showing up to work and things of that nature. If somebody chooses to wear a face mask, by all means, in indoor public settings, but those at higher risk of illness or have higher risk factors, it may be recommended they wear a mask or they check with their healthcare provider to get, further guidance in regards to that. Now, we have kind of straddled the medium between low and medium. Not to repeat myself, but and so it's something important to keep in mind and keep a close eye on, because as we know, COVID testing, especially in terms of at-home tests, is readily available, and that information is not reported. And so when you factor that into case rates, which is one of the metrics that are evaluated for this, it's going to create a little bit of gray area in terms of interpretation. So with that said, with this, the COVID Data Hub, there's some links for testing a vaccine from the local perspective, as well as the COVID Info Center, which is working in partnership with this website. It's done by the health department as well, and it provides all the guidance and other materials that will be helpful for the general community. So with that said, just looking really quickly for the big 7 Connecticut cities, as we like to do, this is interactive as well, but you can see how the case rate, 7-day case rate for Norwalk right here, has been obviously jumping around a little bit, but it has increased to the 70s, as opposed to being where it was in the 60s a little bit earlier in the week. And so that's just really important to keep in mind. But also then every town and city is experiencing the situation differently, right? New Haven just recently, decreased a little bit, but then, Hartford's also been jumping around, increasing a little bit as of late. And so it's just important just to kind of know what the situation is for all the towns and cities. There's also more pages, but to save time, welcome to check it out. norwalkct.org/COVID data. What's important here is the hospitalizations, because it's looking at severity of illness. So what we do have with the most recent data point from the state health department for the state of Connecticut, 375 COVID-associated hospitalizations, which is a little bit of a jump compared to where we were just earlier, where you can see we were at like 326, 320. A little bit before that, we were around 350 or 340s. But this is kind of notable, and this is kind of what we anticipated too, because keep in mind, hospitalizations require somebody to experience severe illness enough to go to the hospital. And so it's indicative that, especially in the aftermath of Labor Day weekend, everybody kind of routine settling, or tomorrow is the first day of officially of fall. And so it's just really important to kind of keep in mind all these different things that are kind of coinciding, as well as obviously with the weather cooling down. Vaccination numbers, just really quickly, just overall for the city for all ages, we're at 89.4% for initiated vaccination, 80.39% for fully vaccinated, and for those booster doses, about 43.93% for the city. And so with this hub, there's also data for the state, so you can kind of do comparisons where we're at. Again, it's interactive. The other important thing, another helpful metric, is going to be the wastewater monitoring, and this is showing it for Fairfield County. And you can see where we were back in the early part of the year in January, but you can see where we're at right now. So the most recent data point shows a little bit of a dip, but prior to that, and as you can see, it's quite notable that in terms of activity, it's still fairly higher than usual compared to where we were maybe a couple of months ago. So it's just kind of important thing to keep in mind. It's all relative, and that's why it's important to look at this data from a broader perspective, temporally, just to see how we're performing and what take into consideration, especially given the caveats I outlined earlier. So hospitalizations and wastewater monitoring are going to be the much more helpful metrics to kind of know our current situation in terms of COVID. So there's other links here for people if they want to access data, and also the social media profiles or Twitter profiles for CDC, State Health Department, and our own Norwalk Health Department as well. So with that said, the primary driver again has been the BA.5 subvariant of Omicron. It's about 85% nationally speaking. But the thing that has been increasing over time, you can see here in this kind of blue color here, is BA.4.6. And so now that is at 10.3% of the nation in terms of the subvariant. So I think that's important to keep in mind. It's going to gradually overcome BA.5. That's what it's anticipated to do. And what's notable here, when you look at it from a regional perspective, it's definitely much more on the eastern seaboard. A little bit, obviously, in the Midwest, notable is there too, but the Northeast definitely having some of that impact with BA.4.6. And so it is also increased infectivity. There's other subvariants that we're also keeping a close eye on, like the BA.2.75. There's concerns that it may enter the season much later on as the weather gets colder and we enter maybe more of the winter time, but it's something to keep a close eye on. So with that said, I mentioned about the wastewater monitoring, and it's all about perspective. So we were looking at the data earlier for Fairfield County, keeping in mind that there is that increase, even though there's that recent one data point that shows a dip. But just also keep in mind the other counties and just how they've been performing relative to this data. And you can see how there's been, just a gradual increase, even though there's been up and down. But you can see that for Hartford County, Middlesex, New Haven County. You can see it for especially New London County with this surveillance. So I think that's important to keep in mind overall. And that's showing obviously wastewater. So somebody shedding the virus and enters the wastewater system, goes to the treatment plant, and that's when they collect the specimens. Obviously, 'tis a season for respiratory illnesses. I think that's something very important to keep in mind. And so flu is the other big thing to keep in mind as the weather cools. There's definitely a seasonality with influenza. And so right now, this is the CDC data for influenza-like illness activity, and you can see how the South, especially like Texas or New Mexico or the Southeast, especially with Georgia, you can see that the activity is much higher than say the North. But you can see how Connecticut actually is a little bit higher as of late with this recent data on a weekly basis that the CDC provides. And so we're a little bit on the higher end of minimal activity in comparison to the rest of the Northeast. So it's something to keep in mind. This data does fluctuate, but it's important to monitor. And then also with District of Columbia, so DC. So then also switching gears, we also have monkeypox that we're keeping a close eye on. So the most recent numbers for the state of Connecticut is 123. And as you can see over time, this little section over here, it has decreased to some extent. It's obviously not as high where we were in like mid-August, but it's something again that could very much change. And then looking at the data, in terms of the counties that have the cumulative case counts, Fairfield County has been the highest at 43, followed by New Haven at 34, Hartford at 29. So that's important to keep in mind as well. And then also just the general demographics of those impacted. You can see how the majority has been the 20 to 49-year-old age group. But what has changed a little bit is actually the 50 years age plus. So that also has increased to 13 as of late. So that's an important item just to consider as well. In terms of the gender that has been impacted the most, it's very notable. The majority is male. In terms of race and ethnicity, non-Hispanic white is the largest volume in terms of 45, Hispanic 35, non-Hispanic black at 27. So again, the general picture of what has been happening, it's been noted, obviously, this has been more close, prolonged contact, usually more intimate sexual contact. But as you can see, especially with the other data, it's typically been a large majority men who have sex with men in terms of the transmission pathways thus far, but there have been exceptions to that rule. So still not great that we have such large numbers in terms of 123, but also not bad in terms of what it could be, especially when we compare it to where COVID's been. So obviously evident that the transmissibility of monkeypox is nowhere on the level of COVID, but it's still important, especially in terms of outreach and other things to consider in terms of groups that might be more vulnerable to it in terms of exposure. So just being mindful of that as well. This is just overall for the country. So keep in mind that California and New York have been the largest volume. As you can see here, it's sorted by in terms of number of cases. So California almost 4,753, New York at 3,810. Other things to kind of keep in mind, I'm just going to go through this really quickly. There's been some wastewater surveillance for polio, as we know, with the New York situation and the detection of actual human cases there and in their wastewater surveillance. So far, no indications thus far with Connecticut, with the archive specimens that have been evaluated for any detection of polio, which is good news. But again, there's exceptions to that rule, right? If somebody's on a septic tank system, that's not going to make it into the wastewater system. Other kind of caveats there too. So it's not a perfect, there's still gray areas. It's not perfectly indicating there's no polio presence, but so far there haven't been indications yet of human cases in Connecticut. So it's still important because it is a vaccine preventable disease to make sure everybody's up to date with their vaccines, not only for COVID, but flu, as well as polio and every other vaccine preventable disease that we have a vaccine for. And then the other thing to keep in mind, there's also recently, the health advisory from the CDC in regards to enterovirus D68. Just really quickly, it's just another virus that can transmit, from the via respiratory routes. It's just really important. Again, people follow proper hygiene with washing their hands, being mindful if they're sick, not showing up, checking with their physician as well, especially if, their child experiences any sort of irregular numbness or, some sort of anything with their limbs in terms of, not being able to, having sudden limb weakness, essentially. So that's going to be just important as well. So checking with their physician is going to be a great way to catch this because that's going to be in the mix with everything else that may seem like flu or COVID as we approach, the colder colder weather and the bigger, heavier season. And then finally, vector-borne disease. We want to keep this in mind as well. So we have 2 human cases thus far in the state of Connecticut, one in Milford, one in Wallingford. The Milford case was an elderly individual, but the newer Wallingford case was an individual that was, in their 30s. This individual has been doing well in the hospital, but nonetheless, it required hospitalization. And so it's still important that people follow these prevention measures until we get to that first solid frost. Mosquito activity is still going to be very much abound. And again, the point to hit home here is, as you can see with the West Nile virus positive mosquitoes in the yellow, a lot of that density is centralized in the southwestern part of Connecticut. So that's, predominantly Fairfield County and including Norwalk. So that's important in terms of prevention measures as people kind of go out and make sure they're covered, making sure that, they're using obviously an appropriate insect repellent. And just, being mindful of that as well. So just want to kind of share all those things. A lot was covered. Thank you. All right. Appreciate it.
Thank you so much, Brian. And if it's okay, can I pass it on to Teresa for her updates, and then that'll be the health department.
That's
that
great.
okay?
And then we can open the floor to questions for the entire health department at once. I think that's a great thing to do. Thank you, Director Demore.
Thank you.
Good evening, everyone. Thank you for inviting me back. I just wanted to provide a super brief update on the mobile pantry that Connecticut Food Share and our community partner at Malta House are bringing to Norwalk. Thank you to this committee for supporting that work by authorizing the use of the Ben Franklin property for this mobile pantry. We received an update today. The pantry is now scheduled to start on October 22nd. It will be scheduled for the 4th Saturday of each month. The partners at Connecticut Food Share and Malta House, who are running the pantry, have noted that the 4th Saturday in November and December fall on holiday weekends, so they are looking to reschedule those. But we're working to pull all that information together and get it out in communication. So the city's role in this, in addition to kind of facilitating the use of the property, is really to support this pantry by getting the word out, right? So helping with promotion and communication about this great resource, but then also there are a lot of other additional new food resources that are, that are operating or coming to the city. So I don't know if you noticed that Person to Person has a mobile pantry function now as well. And I believe Connecticut Food Share will be bringing some more resources to Norwalk. So we're just working on collecting all the information. There's a lot of details, a lot of logistics, and making sure that the public knows where they can go to access these food resources. So we're very excited that there are these services available for our city residents. And that's my update. Thank you.
Excellent. Thank you so much, Assistant Director Argandesi. Thank you, everyone in the health department. Any questions or follow-ups from our committee members? I see Mr. Burnett.
Yes, thank you, Chair Johnson. 2 questions. One, related to the vaccine. Do you know which the current booster that's going to be available, which variant that addresses, or does it address all of the current variants? And then the second question is there a time frame or a suggested time frame between getting the booster shot and the flu shot, or is there no relation? You can get them at any time. Thank you.
You want to go first, Teresa, and then I can add anything?
Sure. Yes, absolutely. So that's a great question. The vaccine that is available for booster doses right now for anyone 12 and older is the new bivalent booster vaccine, and that comes for Pfizer. It's available for folks 12 and older, and for the Moderna brand, it's 18 and older. That covers the BA.4/5 variants, right? So that was formulated specifically to provide an immune response to the BA.4/5 variants. Right now, there is not a bivalent booster authorized for individuals ages 5 to 11, or for that age group of 6 months to 5 years old that is only has primary dose series authorized for them right now. But for anyone offering a booster at this point, they're all bivalent. and for that age group of 12 and older. And then the second question about flu vaccine and COVID vaccine, they are authorized to be given at the same time if you want to, if you're going to a provider that is offering co-administration of both of the vaccines. We recommend anybody talk to their healthcare provider if they have any questions or concerns about their individual circumstance and whether or not they should get them at the same time or space them out in any way. But they are authorized to be co-administered, so you can get them in the same visit.
I have nothing to add. That was perfect.
I just thought I'd ask. That's a thank you very much. Great questions, Councilmember Burnett. Any other questions, follow-ups from committee members? I know I wanted to say too that I've heard that there are a couple other food pantries as well. I think is it Church of Macedonia is doing one. All these, if I'm not mistaken, Chief, they are on our community resource hub, or is there a place we can? You know what I'm going to ask. So
Sure.
Yeah.
So Teresa, why don't you remind people where they can find, and then I'll follow D and I'll piggyback at the end of Teresa, just to remind people of our community resource hub.
Sure. So specific to food pantries and meal services, we have a flyer that we update quarterly. You can find it at norwalkct.org/meals. And I will tell you right now, we are still trying to pull together the details for all those new pantries to get them onto that flyer. So they'll be included there. And then we're looking to try to do a separate communication about these new, especially the weekend pantries, since there's a lot of additional ones. So kind of highlight the newest ones and then also incorporate them into that norwalkct.org/meals flyer.
Great, thank you. And I just want to remind the public and also our council members that the Community Resource Hub is operating, and we had an amazing press conference about several weeks ago to promote it and remind our residents that the number for that to call is 203-854-7999. I'll say it one more time, 203-854-7999. And we have amazing staff that will respond to any of your inquiries, whether it's food related or just want to know what are those services that are offered in our community. And we have family navigators who speak both English, Spanish, and Haitian Creole. Thank you, Council Member.
Thank you all so much. Any other questions for the health department? I know we'll come back in your report probably, Chief, about the Community Resource Hub a bit, but I'm seeing none. I think I can, through you, Chair, I'll pass the floor to you so you can introduce our next presenters. I want to thank the health department again for everything. And there's been a lot that's been going on the past 2 months. It's appreciate the update as well from our epidemiologist, Mr. Weeks. So thank you all for everything. Really appreciate your hard work. It's a lot you're dealing with, I know, and we see it and we appreciate it. So thank you.
Thank you. So I'm going to ask our director, Deanna Diamore, to introduce our guest presenter. And although Danielle is one of us, but we do have a guest presenter. So, but I asked Deanna, will she set that up for us and introduce the team for the presentation based on tonight's agenda?
Absolutely. Thank you, Aman. So first, I want to introduce Aniela Fignon. She's a member of the health department team. She's our public health program associate. And so I know some of you have been introduced to her before, but for those who don't know her, she came to the health department about a little over a year ago, and she's been great, an amazing addition to our team. And she has been working very closely with Yaprak Onat, who's from Circa. And Aniela, can you introduce Yaprak to everybody? I think associate. Yeah.
Yes, so she is the assistant director of the Connecticut Institute for Resilience and Climate Adaptation at Uconn. That's right. Yeah, right. Awesome. So yeah, Yaprak has been working on with me on this project, and I am just going to kind of dive right into my slides if that's okay. All right. So. So good evening, and thank you to the Community Services Committee for inviting us to present on climate change, health, and the heat sensor project in Norwalk at tonight's meeting. Like Deanna said, I'm Aniela Fignon, the Public Health Program Associate for the Norwalk Health Department, and co-presenting with me is Yaprak Onat, the
Hi.
Assistant Director of Research at Circa. We plan to provide a brief overview of the project, its scope, and its hopeful applications, and we will wrap up with next steps and questions.
First, I want to introduce who Circa is. If you haven't heard about it, we are a research institute in University of Connecticut, and our aim is to combine the scientific knowledge and bring it back to the communities and increase their resilience in the climate change. And for that purpose, that we are working on multiple stakeholders, starting from state agencies and going with the municipalities like you are. And if you want to learn more about it, you can just go to Circa's website, which is circa.uconn.edu. Next slide, please. And Circa has been working on Resilient Connecticut project, which was funded by Housing Department's National Disaster Recovery Funds after the Hurricane Sandy. And from this Resilient Connecticut project, starting since last 2018, we've been focusing mostly on New Haven and Fairfield counties and bringing resiliency solutions for their flood and heat-related projects. So that's one of the reasons that we are connected to the different municipalities. Our project is in 3 phases. One is just like the planning, what is going on. The second phase is like actually understanding what are the vulnerabilities are. And the third is more like providing the adaptation solutions. And we are at the stage of the 3rd phase of our project right now. Next slide, please. So if you would like to learn more about it, about like what are the vulnerabilities of your area, of your town, you can go to our phase 2 products. We have a whole report and a website and the maps and everything that you can think about it, because our focus on not just like the provide like highlight just like flood maps, but also look for the transportation corridors and like the affordable housing opportunities, critical structures, vulnerable communities, and then we are all combining that with the light of flood and extreme heat and providing resilience opportunities. Next slide, please.
Yeah, Brock, I think this is your last slide in this section.
Okay.
You wanted to talk about phase 3 a little bit, yeah.
Yeah. Okay, so for the phase 3 that we are at right now, we from this like report that we chose like 7 project area, like 7 municipalities to start working on. We actually identified like 63, but South Norwalk, I wanted to bring it to your attention, is one of them. And when we are looking to do providing the solutions for that area, we hired the contractor AECOM, which are going to start this bringing solutions to the whatever the identified vulnerabilities that we had in our phase 2 during this year. And they are going to look for not only just like the flood risk, but also the extreme heat related events. So if you would like to learn more about it, you can go to our website in resilientconnecticut.uconn.edu and then go to the phase 3 products, and then you'll have like updates on the South Norwalk, and they'll have like reports and solutions and for the area as well.
So as we all know, climate change is impacting communities around the world, like Norwalk, where heat waves are expected to become more frequent and intense, and weather disasters are increasingly threatening our infrastructure and residents. A lot of these changes have the potential to directly or indirectly impact human health and safety. So it's really imperative that we evaluate these threats by collecting data to inform public health resilience planning and adapting responses. In 2020, the Yale Center on Climate Change and Health reported on 19 indicators, which include trends in health impacts and environmental and climate conditions. These indicators fall into 4 buckets: air quality, extreme events, infectious disease, and temperature. We're going to be focusing on the temperature bucket. So there are 5 indicators related to temperature that Yale discusses in that report. The first is average annual temperatures. Average annual temperatures have increased by 3 to 3.5 degrees Fahrenheit in each county in Connecticut from 1895 to 2019. The next indicator is extreme heat days. Although the number of extreme heat days, which are days with maximum temperatures over 90 degrees Fahrenheit, did not change significantly in any county between 1950 to 2018. With climate change, we can expect an increase in the frequency of these extreme heat days in pretty much every county. The next indicator is frost days. The number of frost days is basically the number of days with minimum temperature at or below 32 degrees Fahrenheit. And those have decreased from 1950 to 2018 in 4 of the 8 counties. Fairfield County is not one of those yet, but we will see what happens. The next indicator is heat-related illness. So heat-related illnesses such as heat exhaustion or heat stroke happen when the body is not able to properly cool itself. Heat stroke can cause damage to the brain and other vital organs and can even lead to death. Unfortunately, the numbers of emergency department visits and hospitalizations are likely underreported, as medical personnel often mistakenly fail to recognize the cause of illness as extreme heat, especially in areas like Connecticut, where we're not used to these extreme temperatures. This means that we're likely experiencing a lot more heat-related illness than we realize, and our hospital data may not actually be reflecting the heat illness that we are seeing here in Norwalk. And the last indicator in this bucket is heat stress. Heat-related illnesses experienced disproportionately in some populations, like outdoor workers, think farm laborers, workers in the landscape industry, construction workers, people who are experiencing homelessness, and people who are ages 65 and older, which puts a substantial number of people living in Connecticut at risk. The Yale Center for Climate Change and Health delineates the trajectory for the resilience action in 7 steps. And the first step is to monitor current conditions and project trends, which is what we are doing here with the Heat Sensor Project. So here we'll be focusing on step 1, like I said, monitoring current conditions and project trends. The main objective of this project is to map and identify areas vulnerable to heat, extreme climate conditions, and to identify the contribution of the changes in heat to vulnerability. The data will be used to model the differences between heat sensor and satellite measured temperatures and heat vulnerability in the area.
In addition to like what Aniela mentioned, that when you learn about the heat index, you know that in towns, like there's like, because there's more asphalt, less like vegetation, so you emit more heat in there. So that causes like an urban heat island effect. In order to understand that there's like a neighborhood variability, some neighborhoods can just have more heat emission compared to the other ones. We are looking to inter neighborhood variability in terms of heat index. We are also looking for like what kind of environmental conditions are impacting those heat stresses, because we are looking what kind of a urban typology, landscape typology is that. Is that like a more dense tree area versus like a more like the planning conditions is just like leading to that impact. And we are also looking for the social demographic information too. So if there is like just like injustice in emission of these heat information. So we are trying to identify not neighborhood variability, but also look for like in general what we estimate for the heat. Is there actually a difference between the what is projected, what is estimated, what is the forecast, and what the real people are feeling at the street level? And that's what we are looking for in terms of the heat index variability within this project here. Next slide, please. So for that perspective, Circa has been working on identifying the vulnerability. One of the tools that we developed in our phase 2 is the Climate Change Vulnerability Index, which looks for flood, but also the heat that's very related right now. We define the vulnerability in terms of exposure, sensitivity, and adaptive capacity, but these are mostly like what kind of a stress that you are in, what kind of a susceptibility that you have in that area, and how can you cope with that. So we developed a tool, a GIS-based tool, which is the next slide, please. And you'll be able to, from the bird view, gonna look in like what is the conditions there. You can see from the list some of the indicators that we use to define this, like exposure sensitivity and adaptive capacity. And the layer ranges are varying from like climate layers to social layers to build layers to ecological layers. So you'll be able to see that. The purple map shows that what are the exposures. So mostly the stress that you're going through due to the maximum surface temperatures, impervious surfaces, emissivity, and air quality. And you can understand, the only thing that you need to understand from this, like with the first class, is that darker is like bad. The yellow map that you are seeing right now is in terms of like what is the susceptibility without even like stress is impacting in that area. We see that in social demographic indices, and also like coming from with like the building density, building ages, and then general like where the wells are, there's susceptibility in these regions. And then the last map on the corner that you are seeing right now is the reverse, the ability to cope. So you can see that the more darker the colors that you'll be able to cope with, but the Norwalk in general is showing from our indices is less likely to cope due to from the social build and ecological perspectives that we looked into. And that's one of the reasons that we wanted to work with Norwalk as well, so that we can see from these dark points, like where what is the variability, because these grids are defined as like 10 acres, but we wanted to go into more neighborhood information rather than looking from the bird's eye. Bird's eye is a good way to start it, but now we need to learn more about and monitor by monitoring the data. Next slide, please. And Aniela.
Thank you. So the primary data that we are gathering from the heat sensors is three things: temperature, relative humidity, and dew point. And while we're all pretty familiar with temperature and relative humidity, I just wanted to take a moment to explain what a dew point is, because I didn't know when I started this. So the dew point is the temperature the air needs to be cooled to at a constant pressure in order to achieve a relative humidity of 100%. So basically at this point, the air wouldn't be able to hold any water, and even if it was cooled anymore, it would turn to rain or some other sort of precipitation. So the higher the dew point rises, the greater the amount of moisture there is in the air. So that is actually what's directly affecting how comfortable it feels outside. So when we go outside and we think about how muggy it is, that's what we're actually talking about is dew point. Based on those data points, we can develop a better understanding of what kind of heat Norwalkers are experiencing at the ground level. We can use tools like the heat index to gauge the threat of discomfort or health risks due to heat. Keep in mind that these heat index values were devised for shady light wind conditions. So exposure to full sunshine can actually increase these values by up to 15 degrees. Sometimes a temperature we wouldn't consider hot or extreme might be combined with a high rate of relative humidity, which places people at risk of heat-related illnesses. So, for example, an 85-degree Fahrenheit day could put a person at risk of sunstroke with only 65% humidity. And you guys know what humidity has been looking like in summers in Connecticut. I mean, we're getting 80%, 90% humidity levels on a regular basis. So we can adapt tools like the heat index using the heat sensor data to understand Norwalk's specific risks at the ground level where our community lives, works, and plays. Circa and the City of Norwalk's Planning and Zoning Department initially began to discuss the potential for this project in late 2021. And by 2022, the Health Department pulled together an interdepartmental team to work with Circa to identify potential sensor locations. The team ended up getting all of the necessary permissions and permits for the sites by the end of April, and the sensors were deployed on June 9th. Data continues to roll in, and deinstallation is planned for October.
So we talked about the process. Now we want to decide like which locations and how did we choose that. And the red on the left that you see that all the combined indices that I was talking about, the purple, yellow, and then the other differentiated colored map, they all combine to give the heat vulnerability of Norwalk. So the map that you're seeing, the darker colors are more vulnerable regions. And what you're seeing on the right is that the locations that we chose, meaning like all with the city of Norwalk, as you can see from the light colored dots, that they are all in different areas so that we can have a wide variety from the locations. Next slide, please. Another perspective that we think about it when we are deciding the locations is what are the local climate zones. What I mean is that if there is like a compact mid-rise area, if there are like dense trees in there, if it's just like low plants by the park, or if it's like sparsely built area, or it's like a highly like high-rise building area. Not that no one has that, but they are 10 classifications, and then we decided to look into that as well. And next slide, please. So when we look into that, the map that you're seeing pixelated is from a World Urban Database Access Board. So we did the machine learning and identified all these locations, what it looks like from satellite images. What you are going to look also from the points that you can see that we chose, they are all in different areas. So we can get like a good, nice sample as well. Next slide, please. Another perspective that we wanted to look is the demographic information. I'm just showing you one or two information map here. On the left, that what you're seeing is the minority population, and you can look at the dots and then see that they are all in different, concentrated in different neighborhoods. So it can show a variety. And on the right, with the one shaded purple that you're seeing, all these locations show like a different median income of Norwalk too. So we are trying to distribute the sample data and get like a more to tell the data, to make the data tell us the story of like what Norwalk experienced in terms of different landscapes, different demographic conditions, different like build structures, and in terms of like the highest vulnerability regions. Next slide. And we come up with these 13 locations, right, Daniela?
Yes. So as Yaprak mentioned, we came up with 13 locations. I'm not going to go over them again or why we chose them. As she mentioned, it was based on a variety of factors, but I do just want to take a moment here to thank Brian Weeks, our epidemiologist at the health department, and Kyle Benjamin, who works in transportation, mobility, and parking at the city, for all of their work mapping these locations and just kind of their initial assistance with this. It was really very appreciated. And I also want to take a moment here to thank Circa for all of the amazing work that they do and for considering our city for this project. Your leadership, funding, and support have been paramount to the success of this project. So thank you, Yaprak.
Oh,
and we also want to thank the many city departments that were involved in the planning and permissions, as well as Norwalk Public Schools, Veolia Water, and Norwalk Community College, which graciously allowed us to install the temporary sensors on their grounds. As we mentioned previously, efforts began in late 2021 and will continue until mid to late October.
I also want to thank the community partners, because this work would not be done without all of you guys. And so the data that we want to talk about before, like how the sensors look like, because you may walk from your neighborhood and our sensors might be like peeking at you. So we are connecting them either to trees or poles, and they are non-invasive, so either like zip ties or hose clamps, so it's not gonna damage any property, because that's what our aim is. And they are 8 to 10 feet above the street level, so our aim is to capture like what people are actually feeling in terms of the temperature, relative humidity, and dew point too. And they record every 5 to 10 minutes, and we deployed them since June 6th, and then we're going to pick them up later at the end of October. One thing that I wanted to mention is that we had like Bluetooth sensors, and right now the black dashboard that you guys are going to see in your neighborhoods, they are collecting the data and then sending it to a cloud, so it is connected through a cell service, and then we'll be able to download the data every day. Next slide, please. I just want to show you like what the dashboard would look like. We had some technical difficulties during this year due to like a COVID-related delays in the obtaining these sensors. So we just had a chance to obtain this dashboard too. But what it shows is temperature and relative humidity. In the first plot, blue plot shows, and this is for the East train station on August 24th. And you'll be able to see like by clicking or like moving your cursor and then see what is at that point, like the temperature and humidity. You see dew point temperature ranges You see in that dashboard what is the actual temperature that's read, like what is the latest recorded variables there, and how many devices are connected, like the whole that we have, and if we have any kind of a connection issues. We are going to make this dashboard available to public soon, so anybody can in their neighborhood can be able to see their data. Next slide, please. I just want to talk about a little bit of data, just like sample period between June and July 22nd for these 8 locations. The graph that you are seeing right now is just like showing the difference between the East train station data in purple versus the blue shows the Calfpastor Beach. And you can see that there's like a big difference, like 5 to 8 difference Fahrenheit in temperature variances. So we looked at it statistically how each locations are, if there's actually a significantly different from each other. And yes, they are. They show like East Norwalk train station shows like one of the highest average temperatures recorded, while Calfpastor Beach shows the lowest ones. And Calfpastor is makes sense, that has the highest humidity averages compared to the other groups. And in dew point standpoint, like we look for the fire stations has a high variance versus the Huckleberry close to a pump station, which was shaded under a little bit trees, have the lowest variance. This was just like to give you an idea like what kind of things that we can look for in the data too. Next slide, please. Another thing that I'm showing right now, if you look at the plot, the only thing that you need to realize is that these are box plots, show that all these 8 stations, how they are varying within each other. The red lines between those boxes show the average temperatures in those locations, and the ticks show like from the high to low is like the extreme highest and the lowest temperatures are observed in each locations. You can see that how Calfpastor Beach has like a lowest range versus like Uconn Street has like very high range. And the boxes actually show like what are the 19% of the data is like temperature ranges for these locations. What I want to show you also, if we looked for those 44-day record period, I wanted to check when is the heat index reaching above 90, which makes it uncomfortable. You see a difference between Calfpastor Beach can be 5 days versus like Huckleberry Station reached like 16 days, which is a big range. You can see that. And also you'll see the differences between average and then how they're ranging. One thing that I wanted to point out, for example, in July 21st, which was one of the highest days that it's reached in the heat index for that record period. You feel the heat index in Calfpastor Beach in 96 degrees, train station 104 degrees, Uconn Street 107, Naramaka Elementary School 104 degrees. I looked for the airport airport data to see like what is the recorded temperature, because most of the features like the real-time information that you get is like from the closest airports. And I look for the Sikorsky Airport and they just measured 93 degrees, 94 degrees. So you can see that actually like what is recorded in the airport close there and then what your city is feeling ranges a lot. And then that can impact a lot for the communities who don't really have like an air conditioning or a cooling center. Next slide, please. And if you look at these graphs, like what you need to focus on, they just show that when there's like a maximum heat index changes in that day, the same day I'm talking about. Another nice thing that you're seeing right now, okay, from the night, it is like cool, and from 6 a.m. it is increasing. And then you see a low, and that's from actually from the wind that's coming to your, from the Long Island Sound. And then you go to peak again around like 6 p.m. This is very nicely shown in these graphs, and also you can see the variety from each of these locations, and that's what we are going to focus on in our future analysis as well. Next slide, please. Okay, so what is next in Circa's part is understanding how this urban heat island impact is varying from all neighborhoods. We are going to look for how the different landscape typologies all these 13 locations had, and how it is related with the temperature they're observing. And also we are going to associate that with the socioeconomic variables. Another thing that we are going to look is like how I showed with the airport data, differences between the heat indices. We are also going to look for the satellite images, because most of the computer calculations and the future forecasts are done by that as well. So that can help us to decide like what kind of a resiliency that we can bring it to the towns, because mostly people just measure from the satellite images and then say that, okay, you know, that's good, but they generally measure the satellite images just like top surfaces like rooftops or like the asphalt, but what people are actually feeling, that's what we are going to do the comparisons. And for the health impacts, of course, Aniela can guide that better, but we are trying to see like how we can see a trend in these range, and also if that is we can link it to some kind of a emergency department visits compared to what the estimates would be. And next slide.
So as Yaprak was talking about, how do we use this information at the local level? Well, we can do things like continue to collect data, strengthen and develop policy, work on things like the city's POCD, enhance existing programs and resources, develop new programs, educate ourselves, our city leadership like yourselves, community-based organizations and community members, and so many other things. So there really is just a lot to be done based on this data. Thank you so much for listening to us. We are now happy to take any questions.
Thank you for having us.
Thank you so much, Yaprak and Aniela, for this amazing, data presentation, but also just to give us the background as to why we're doing this and why it's so important. Any questions or follow-ups from committee members? I see Mr. Burnett first.
Yes, thank you, Chair Johnson. This is a great presentation. This is very fascinating and very important information. I'm curious if you're aware of any municipalities similar in size to Norwalk that have gone through this level of data collection.
Yes.
And more importantly, what were some of the action plans that they put in place to address the data that they collected?
I would like to answer this. So the first part is that, yes, we did in New Haven a pilot study starting from 2020 to 2021. And right now we are actually also doing it in Danbury. So those are the towns that we worked with. In terms of like what kind of a resiliency plans or action plans that they've been doing it. So analyzing, we for New Haven, we did like sample data for shown and like how the landscape typology is related with the satellite images and also like with the these heat sensors. We prepared a report for that for suggestions and point out like what are the areas that are emitting more. The action items wise, that's why the Circular Resilient Connecticut Phase 3 is working on, but specifically, we haven't started yet because we are still collecting with Norwalk and they're still collecting with Danbury.
Excellent question. I had a similar one as myself. Thank you, Councilmember Burnett. Any other questions from committee members before I ask mine? All right, I thank you again, and I know this has been something because we've been talking about the urban heat islands in our city. So to have this data is going to be so helpful to us because we know we hear from residents how much hotter it is, how they have to buy an extra air conditioner or keep it on longer, or if they don't have one at all, they have to spend more time outside in the shade. We have cooling centers, obviously, and I know that Deanna, your department has been doing, I think with emergency management does a lot of great work there. Is this data going to allow us to see, because what I've been hearing is that a lot of communities are trying to be climate resilient to figure out where they need to put more long-standing, I see you nodding your head, like more long-standing supports for community as the temperature rises. I'll stop the question because I think you understand where I'm going.
Yes, definitely. So I can at least speak like from sort of the health perspective, in terms of, how to mitigate some of the health impacts, there are a ton of options for adaptation and resilience. A lot of these things have to do with public education and access. So like you said, kind of figuring out where those cooling centers really appropriately should be located based on those heat islands that we're seeing. And then also thinking about access, if a heat island is somewhere where nobody can go, is there a point in putting a cooling center there? Maybe not. But if it's something that's accessible and something that, isn't just accessible, but also attractive to community members, then we can make that into a more useful kind of action item. There are also a ton of zoning, kind of like tweaks that we can make to allow for different kinds of infrastructure, such as green infrastructure, cool pavements and asphalt, cool, like cool roofing, which can take the form of reflective surfaces, putting in tree canopies, which is known to cool the surrounding areas, not just, where the actual tree is, but, up to like several blocks away. Urban parks, large urban parks are actually known to cool neighborhoods up to a half a mile away by 6 degrees. Water features, like urban water features. So thinking about implementing or installing water fountains throughout the city where people can access, clean, healthy water, water sprays that people can walk through in like pedestrian areas to cool off. Other kinds of water features like small ponds and things like that, that might also provide that cooling effect in the area. There are things that we can do that are kind of smaller projects, like implementing bioswales, which are basically these like little tiny like rock plant gardens that go on the edge of like a street, and then they funnel the rainwater that comes through, and that rainwater goes into the storm system. And that's sort of multifunctional in the sense that, it is taking away from the impervious surface, that would otherwise just trap heat and kind of shoot it back up into the atmosphere, and also has like the clean water cleaning effect. So yeah, there are a ton of different options around this. It really just depends on what angle you're looking at it from.
That's excellent. Thank you so much for that information. I think, we've been going through a zoning rewrite. We've started hearing some of these concepts discussed, and I think in particular talking about adding to our pervious surfaces in this city, I think could be a real game changer for us, right? It seems so, because the way that the data suggests how it traps heat is very interesting. Thank you for everything. I want to just do one more check of any committee members who have follow-up information or questions. I think we're set. I just am so grateful. I know we were going to maybe have this presentation a month or two ago, so I appreciate you coming back and having a little delay, but it meant so much, Dr. Onat, and I'm so grateful to, I think this is your first Community Services Committee Zoom, Aniela, is right? Okay, so welcome. Thank you. It's great to have the health department thinking about the climate impacts on the health of our residents, of course, and that's such a big part of this. I know we've talked about it, Director DeMoore, so thank you all so much. I guess with that, I turn over our agenda to Chief Daniels for your part of.
Thank you. And I guess we'll go straight through since I'm also presenting the
let's go straight through
the action items.
Thank you.
And let me share that both Anna Vivian Estrella, our Human Services Director, and Mary Astor are in Chicago with the Norwalk Acts team as they are engaged in the Strive Together Collective Impact conference there. And we look forward for their safe return as we continue to partner with our colleagues over there. So, oh, please excuse me. So just in terms of quick updates, and again, it's been 2 months since we have met, and we made a commitment that we would both keep this committee and the public abreast of where we are in the Equity and Justice for All initiative. So as 2 months ago, we put forth the job description and posted it throughout the region for the Equity and Inclusion Officer. So as of today, we interviewed several candidates And just most recently, we had a second interview with a candidate. So we will be continuing that process. Our new HR director is leading the process. So we look forward to meeting the additional candidates and having those second interviews, because the original ones were on Zoom. And then hopefully in the near future, we'll keep you posted that we'll be able to announce the city's first equity inclusion officer. So we're really excited about that. And then secondly, I mentioned this, and for sake of time, yeah, let me just put it up anyway, if you don't mind, Chair. I was going to move fast, but let me just quickly, okay, share screen. Okay, you know, I'm really, can you all see that? Let me go to this.
Yes, we can.
So, excuse me. On August 25th of last month, Thursday, we made a public launch of the Community Resource Hub. I think Council Member Burnett and me, I think others are not here, that, you know, this is something that when I first arrived, literally 3 years ago, October would be 3 years I've been in this role, you know, I was very adamant around, I think the city, you know, in terms of looking at a strategic process of how can the city show up in the community with respect to budget and resources. And I proposed the Community Resource Hub. So it is just building and thriving. And with the public launch, I can tell you we are extremely busy. And so for if you would just indulge me just quickly, you know, this gives it a nice visual. I can't take credit for this particular visual. Anna Vivian kind of created this and mapped this out for us, but I think it gives us a really nice visual, both for you all and then those that may see this later on around the community resource. How can your city help? And it starts where you can connect with us either online, walk in, or give us a call. And then that next step is we listen. Tell us what's going on. We have trained professionals that just are good listeners to help you be a listening ear, be a support. But they're also trained to understand what is available in our city. And even if that means looking, you know, beyond, right, from a regional perspective, they have firsthand knowledge of what those services are. And then help you identify and understand your needs. And then the exciting part is providing people with information, knowledge around what's out there. And so our navigators help you find those local resources and services. We can tell you right from that engagement if there's a waiting list, what is that eligibility, what might you need? And because we have live people, we'll help you fill out the forms, because sometimes those forms can be so overwhelming. And then some of our residents just have no idea. Well, you can come in and our navigators will work with you and help you understand what you have to need, what you need. And then, as I pointed out earlier, that we're so excited because we're very want to make sure we're meeting the need of our constituents, that our navigators, English, Haitian Creole, and Spanish, but we also have the language access line, that there isn't a language that we don't have staff that can speak it. We have those resources. And then the success is you walk away with having a clear idea of what those services are. And then if you're still stuck, you can come back. It's an open door policy, no wrong door. And then, you know, we are now taking advantage of technology. You see that really nice QR code. You can also call us. So this is the flyer. And if you put your phone to the screen, that QR code, and you can fill out a referral form, and we'll call appointment. But again, you can come in City Hall and we'll gladly be able to assist you. And remind our residents that the number is 203-854-7999. And then the other piece in terms of update, I want to share about our fair rent office, because that is an office that continually is increasing in terms of residents. We want to remind our residents that if you feel your rights are being violated as it relates to unfair increase in rent, your city, this is a city function, have the fair rent office. And in terms of an update to this committee, we are excited that we made an offer to our ADA field representative who will have part-time ADA work and part-time fair rent. They accepted. So in these two positions we've been working on for about a year because we had to hire a contract attorney because these were specialty positions and, you know, they're just not many out there. So we're really excited. And we recently, I think I can share this. I hope I can. We recently made an offer to to the city's fair rent officer. And this is a full-time position. Again, we've had a contracted attorney, but we really need someone in the office every single day because that's how busy we are. So I'm crossing my fingers that this individual accepts because this service is needed. And then to remind, you know, our city should take pride that the fair rent office has been existing for many, many, many years. And just recently, the state of Connecticut, through state statute, has mandated municipalities with a population, I want to say over 50,000, I couldn't remember, that they must now operate a fair rent office. And so we are looked upon once again as a model in terms of how we operate our fair rent office. So residents can call 7989, or they can call the community resource number. All those numbers are now interconnected. What's important is no door is the wrong door. Whatever number you find, call that number and we'll make sure to connect you to the right service. And again, the fair rent office, we do encourage appointments because we are busy. But most certainly, if you walk in, if you could be patient with us, we'll serve you. We'll have someone meet with you so we can understand your case, and then we'll connect you to the contract services. So these are just two services that I really wanted to highlight today because I'm so proud of the team. I want to thank this committee again for supporting the vision and our thinking around how do we as a city provide and serve our constituents. And we have an amazing team. And I believe this is a service that residents have. You know, from the press conference, we had a resident speak, and again, it just speaks to how we know the needs, and we're being reflective of how can we help our community. And I think that's it for the community updates. To return it back to you, Chair.
Thank you very much, Chief Daniels. I appreciate that very much, those updates. I know that we've been talking about possibly having the ordinance for the Equity and Justice for All Commission come through the ordinance committee as early as next month. We're not quite sure yet, but that is something that we're working on. Of course, we want the new Equity and Justice the Equity Inclusion Officer to take a look at that draft. Absolutely. So we won't get ahead of ourselves because we need that expertise. So any questions? Comments, follow-ups for Chief Daniels from the committee? Thank you for that information. It's good news that we have fair rent. I know that we talked a lot about the language line in this committee. I know that that's going to be something, as I understand it, that role also will be working with and addressing. Is that right, Chief Daniels?
Thank you for that great question. So the fair rent and accessibility coordinator, that would be one of their roles, not only to ensure that the service is available, but they'll be working throughout the city with all our municipal departments to ensure staff are trained and that we're using it to the best of the ability to make sure that folks are aware of that service.
Fantastic. That's great. I think what this means, unless my colleagues have any other questions or follow-ups, we could move on to the action item. And I know you'll be presenting
Yes.
for us. All right. Well, I will give you the floor then for that action item this evening. Our last order.
I'm sorry, pardon?
No, just stating it's our last order of business.
Oh, great.
So take it away.
I know we missed Council Member Diana Revelos because I know I'm looking for her to say, ready to adjourn. So tonight we have before you, this is a biannual grant that since I've been here, I think Mary Oster has presented this grant. Just from a historical context, this was the grant that a decade ago, the Norwalk Housing Authority oversaw with the early childhood programs, because those that know the history, Norwalk Housing took the lead in the grant providing early child services in many buildings. And then during that transition many years ago, the city has absorbed that funding, and through the Early Childhood Council under Mary Oster's leadership, the funding comes through the city, but through the Early Childhood Council, the funding is dispersed. And it's $3.7 million as noted. I think it's just important to remind, all of us that early learning is important. As Mary Oster would say that, to ensure that our young ones have early education access to learning, so that when they are entering kindergarten, they're ready and have those skill sets. And so this is a grant from the state of Connecticut, and it subsidized those slots based on a variety of eligibility. And one of those eligibility is income. And as noted in the materials that you see, that this includes individuals or families that fall 75% of the state median income. I'm a dad myself, and childcare is expensive. And I can only imagine those that cannot afford it, what they go through, because we think all children deserve early learning experiences. So this is the grant that subsidized the slots, as also noted in your materials. We're looking at 103 slots that goes to Ben Franklin and Nathaniel Ailey. If you recall that during that transition from the Norwalk Housing Authority, the Connecticut Institute for Communities is that grantee that has picked up that particular program. So that funding comes through us, and we subsidize 103 slots to ensure Norwalk children are ready and develop those skills. So Mary also provided me with some information that I'll just share with you, that the number of slots have been determined from the Norwalk Housing Authority that they had in each building. We did convert some of the preschool slots to toddler based on the data that we learned about. We needed more toddler slots in Norwalk, and at the time we weren't readily filling the preschool slots. So you'll see there's a mixture of both toddler and preschool slots. The capacity of classrooms go by square footage. I remember previously people wondering why did this site get 10? Why did this site get 15? Well, there's also state licensure and regulations. The maximum size is 8 for toddler and 20 for preschool. And just some rooms aren't large enough to accommodate that number of children, so they do have less children. But again, there's the Early Childhood Council that's been in operation for many, many years. They help facilitate and make a determination. Mary Oster oversees the funding. And so we're just, again, pleased that this is a biannual grant. We continue to get this grant, and we continue to support the early learning centers in our city to ensure that Norwalkers, our young ones, have access to early learning.
Thank you, Chief Daniels. I was having internet connection issues. I hope people can hear me all right. Okay, good.
I can hear you.
All right, great. I know we need to enter this in, make a motion for this. Thank you for that information ahead of that. We can certainly open up for discussion after we make a motion. Would anybody like to make a motion for this item?
Madam Chair, if just for the record, I think the motion needs, the action needs to be read, and then we would call for the motion.
Thank you. That's right. I guess because of my internet, I was wondering if somebody wanted to read it, but I can do that for sure. I'll read it as long as you can hear me. Thank you, Councilmember Burnett. I appreciate that. I'll read it and then call for the motion. Now I know, well, we'll talk about that, but authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary to accept and receive child daycare grant funds allocated to the city of Norwalk from the state of Connecticut Office of Early Childhood, OEC, in parentheses, for state fiscal year 2023 and 2024. Thank you, Councilmember Burnett, for our protocol there. I will defer to the floor, perhaps you, for the motion. Anybody?
Councilperson Johnson.
Yes, Ms. Ayers.
I so move the motion.
Thank you, Councilmember Ayers, for moving this. Appreciate that. You've made that motion. Now it's on the floor, and we can have some more discussion. More information from Chief Daniels, should we like. Thank you again for the presentation. Anybody have I have one question, but I don't know if I'll open to the floor first. If any of my colleagues have a question. Councilmember Burnett.
Thank you, Chair Johnson. Chief Daniels, each year, this is fantastic that we can get this funding and our young children, students can be better prepared as they enter into the normal public school system. I'm just curious that if we, at any point, do any type of data collection on the value of the program of those students that go through the early childhood preparation versus the students that do not, and what is the difference when they hit when they enter into the public school system? Are they further ahead versus those students that do not attend? Are they further behind? Just trying to get a better understanding of the value of this program, which I'm sure has a lot of value.
Sure, that's a great question, and if we want, I definitely can have our colleagues from Norwalk Acts, because as part of the Norwalk Acts work groups, early learning is one of their goals. So they actually really do a deeper dive in the data. But Councilman Burnett, what I can tell you is that all the programs where this funding subsidizes, that all the centers that by the state guidelines that they must have the National Association for Education of Young Children accredited. So all the programs have to go through this rigorous accreditation. We do allow them to receive money, but within the 3 years, they must remain accredited. If they don't, the funding will be withdrawn, but then the continuation of receiving funding, their accreditation must be maintained. And through Mary Oster's role, she is required to make site visits to both observe the teachers of both the classroom to ensure that they are meeting these rigorous standards as outlined by the Office of Early Childhood from the state of Connecticut. Also, to your point, Councilman, the centers are required to submit monthly program status reports to the Early Childhood Office. These are reviewed and consolidated and also forwarded to the Office of Early Childhood. What I don't have, but I can speak to our colleagues in terms of, which is a great question, the comparison between the children that are in these programs and what that looks like in school. I think that requires a further conversation, because we would need to partner with the school to release that data, because once the children are in the schools, that are we don't have access, but that's something we can look at. But I can definitely circle back and talk to our colleagues. They're all in Chicago right now, but I do know just anecdotally that they are tracking and want to build a database so that we can understand, what the reason why these programs work and why we want to continue, as Mary Oster would say, with campaigns of families who don't send their children to early childhood. And we do know many of the reasons, but we want to encourage them that the research does suggest that children that have early learning experiences do well.
Thank you, much appreciated.
Thank you.
Thank you very much, Chief and Councilmember Grant, for that great question. My other two colleagues, if you have any questions or follow-up, otherwise I'll just defer to our finance chair, Mr. Burnett, but I assume we're just authorizing that we can accept and receive this grant from the state. We don't need to put the dollar amount, if I am correct?
That is correct.
Very good. Thank you so much. I'm calling you Chair Burnett because you are the finance chair. So all right.
That's right. That's right.
So I think I'm very happy with this update. Thank you. And I think that as my colleague, Mr. Burnett said, this is just such important work to keep this going now for fiscal year 2023 and 24. We have the motion, thanks to Councilmember Ayers. So last call for any questions or follow-ups. Otherwise, I think we can put this to a vote. All right, well, we'll put it to a vote. So all in favor of the motion as presented by Councilmember Ayers. I see her hand is up. It's unanimous, all four of us. So this was passed on to the council unanimously. Thank you all so much.
Thank you so much.
And it does say our next regular meeting we will have in October. I do believe we have at least one action items so far as I think we will have something. So we'll see you all in late October. And thank you all so much. Hope everyone's had a great summer. And I can look for, because our colleague Ms. Redlus is not here, who would like to motion?
Oh, motion to adjourn.
Okay, there it is. All right, well, thank you. That was pretty quick. That's good. All right, everyone, have a very good night. I appreciate you all. Thank you.
Thank you, everyone. Have a good evening. Thank you.